All right, so these are things I already said. But anyways, one more point, cryoproteins do not bioaccumulate in fast tissues, which is different than other insecticides. And that research is going to support that cryoproteins are non-allergenic. Okay. This table right here is a summary table of example studies where they did testing for acute toxicity in mice. And again, there's a different test substances here are the different cryoproteins, but they also have on this table BT microbial products. So this is going to be cryoproteins in sprays. And what they did in these studies, there isn't a huge amount of studies listed in this table, but some of them are, for example, published by the EPA. They looked for the highest dose test that caused no adverse effects. And I just want to give you an example. For this top test, the highest dose that they were able to give the mouse without having any adverse effects was 400 milligrams of cryoprotein per kilogram of mouse. And if we think about that in comparison to a human, then that would mean that a human would have to eat 900,000 kilograms of uncooked corn, which is 35 semi-trucks. So you'd have to eat a huge amount of cryoproteins in order to have any adverse effects or acute toxicity. And that's likely true of any protein that you might eat. And so next slide is another table. This is a table of studies that were done with repeat dose toxicity. And so this is when they would feed the animal the cryoproteins or the diet that included cryoproteins over time, multiple times. And it lists out also from a BT spray, BT microbial formulation, and the study length here. You'll see that most of them were rats for 90 days. But overall, these studies do suggest that the cryoproteins are not toxic. I do want to make a disclaimer. Although this is the most thorough review paper I have found by Koch et al. In 2015, the source of these two summary tables. A caveat here is that those authors are employed by Monsanto. And again, Monsanto is one of the companies that makes BT products, BT crops. And so we have to be careful looking at the information, because the information is coming from a company that has a monetary interest in success of their BT crops. And so I don't want to say that this information is therefore useless, because it's not, but it's possible that they chose studies to present that support their case. And sometimes with literature, it can be very difficult to understand the whole story, especially when there's dozens and dozens and dozens of studies on the same topic. And so I haven't read every single paper about the potential toxicity of BT crops. But this review paper does suggest that they are safe. And the review paper did go through a peer review process. And so a little bit of trust has to be made in the reviewers that they determined that the data that was shared was presented in a non-biased way and is accurate. There are still a lot of things that are unknown that need to be found out. And again, a lot of this is just limitations in the scientific process. So for example, like you saw in that previous table, Most animal trials for stuff like this are limited to 90 days. And that's just typical for animal trials. When this study was published, there were only 12 total that were greater than 90 days. And we don't have any long-term studies on humans. In order to test for the toxic effects of cryoproteins on humans over a long time, that would be really difficult and also probably unethical. You'd have to have a way where you'd have a portion of your population eating organic versus the portion of the population not eating organic. And there's just so many variables in human health that those studies are just really difficult. So I don't know if and when a good one will ever be accomplished. In addition, most of these studies on animals do track things like mortality, body weight, and pathology abnormalities. But again, just like with the non-target effects, overall information about non-lethal effects is less well understood, especially compared to lethal effects like mortality. Okay, so again, the FDA does review the information that is provided by the companies before they make their decision, but the information is coming from the companies. Okay, so that's a little bit of a different strategy that the United States employs compared to other nations like those that participate in the EU. The EU is much more strict on genetically modified crops, and most of them are not approved. The United States tends to take the perspective that things are safe until otherwise proven, whereas like the EU will be more likely to have perspective of things are not safe until they're proven safe. So that's why there's differences across the world about GMO regulation. So in addition to these things that we know we don't know, of course there's going to be things that we don't know that we don't know. Okay, so that could potentially be the thing that the EU is worried about. If we know of a knowledge gap, we can pursue it. But human beings have only been eating genetically modified crops for about 20 years. The first introduced genetically modified crops were in 1995. So we're coming up on 25 years. And so I am sure that in the future, there'll be some things that we wish we had known. My goal for my lectures has been to just explain what the crops are and what is considered. It's not my goal to sway you one way or the other about whether or not you think they should be approved or eaten or not eaten. I want you to leave this class knowing what they are and what the regulations do consider.